Good afternoon. My name is Dr. Jeremy Adler. I'm the Tippecanoe County Health Officer. Welcome to our COVID-19 press briefing. Today I'm happy to be joined by West Lafayette Mayor John Dennis, Dr. James Bean from IURNet, Dr. Daniel Wickert from Franciscan, and Dr. Esteban Ramirez from Purdue University. As many of you are aware, the incidence of new cases of COVID-19 is rising across the United States. Indiana has not been immune to this, and neither has our local community. In some areas of the U.S., the situation has grown to dire levels, and let's talk about our local data and what we can do to ensure that our community keeps moving in the right direction. On the screen, I have summarized our 5 data points that the local health department is monitoring with regard to COVID-19. Just to review, the first one is the number of new confirmed COVID-19 cases. The second is the percentage of COVID-19 tests that are positive. The third is the number of COVID-19 hospitalizations, including the number of intensive care unit and ventilator patients. The fourth is the number of emergency department visits for respiratory illnesses, and finally the number of deaths due to COVID-19. This next slide shows our current COVID-19 status. Cumulatively, we have 1,019 cases of COVID-19. Of those, 330 are active, 678 have recovered, and we've had 11 deaths. In the last 28 days, we've had 379 new cases of COVID-19, and in the last 7 days, we've had 112 new cases of COVID-19. Looking at our cases from a day-to-day standpoint, this graph shows the number of new confirmed cases of COVID-19 in Tippecanoe County every day, going back to March 18th, which was the first day that we had a confirmed case here in our county. And as you can see, the general trend showed a peak in early May, followed by a decrease in new cases throughout May and June. However, at the end of June, our new cases began to increase, and that increase has been more or less maintained since that time. Because the number of new cases does fluctuate from day to day, sometimes it's useful to look at the number of new cases daily, average number of new cases daily by week. That's what this graph shows. And as you can see, the curve of this graph is similar to the curve on the previous slide, showing a bit of a peak in early May, followed by a decrease through May and most of June. However, when you get to the latter part of June, the average number starts to increase again, and currently is sitting at a fairly high point, 16.4 last week and 15.4 this week. This next slide shows the number of COVID-19 tests that have been performed in Tippecanoe County. Cumulatively, 19,146 tests have been performed. 5.3% of those tests cumulatively have been positive. Within the last 7 days, we've had 2,140 tests performed, with 5.2% of those tests in the last 7 days coming back positive. For comparison's sake, in the state of Indiana, the cumulative percent positivity rate is 8.9%. For the U.S., cumulatively, that percentage is 9.6%. For the week of July 5th through July 11th, for the U.S. as a whole, that number was 9.2%. So we are below the state and national percent positivity rate, which is a good thing. This next graph shows our percent positivity by week, going back to early May. And as you can see, the shape of this curve is very similar to the other graphs that I've shown, with a peak at the early part of May, followed by a decrease into June, and then an increase as June ended and we headed into July. Currently, again, 5.2% is our percent positivity. The World Health Organization has stated as a goal for this percentage to be less than 5%. This next slide summarizes our local hospitalization data for COVID-19 and shows the peak number of hospitalizations for COVID by week going back to late May. And as you can see, the numbers did decrease during June, increased a little bit as we headed into July, and have decreased since then. Currently, 13 patients with COVID-19 in our local hospitals, 4 of them in the intensive care unit and 1 on a ventilator. So the top line is the number in the hospital with COVID-19. The second line is the number in the intensive care unit, and the bottom line is the number on ventilator. And lastly, the emergency department visits in Tippecanoe County for respiratory illnesses. This number did increase heading into June and has, for the most part, maintained itself fairly at a stable level, with 190 visits occurring to our local emergency departments for respiratory illnesses within the past week. So again, to summarize, we have, just as the rest of the state has seen in many parts of our country, have seen an increase in the incidence of new cases of COVID-19. And it is extremely important for all of us to look at this data and to really act on this data and take the appropriate measures so that we can get this curve to move in the right direction. We don't want to see this curve continue to increase like it has in many parts of the U.S. And so for all of us, we need to make sure that we are wearing our face coverings as mandated by Governor Holcomb's mask mandate. We need to avoid crowds and maintain a social distance of 6 feet when we're in public settings. We should frequently wash our hands and disinfect frequently touched surfaces. If we are sick, we need to stay home. If we have been directed to quarantine, we do need to stay inside and quarantine if we are a close contact of a confirmed case. Individuals who are 65 years of age and older and those with high-risk conditions should remain at home whenever possible. In addition, businesses should modify their operations and their workplace environments to optimize social distancing. It's very important to remember that even with the mask mandate, these other measures, such as social distancing and hand washing, are still critical, and we need to do all of these things to prevent our cases from heading in the wrong direction. Lastly, I did want to mention that we are fortunate in our community to have several options for testing for COVID-19. In addition to our local hospitals, the Indiana State Department of Health currently has 2 testing sites that are open to the public. One is at the White Horse Christian Center on Cumberland Avenue in West Lafayette. This site will be open through Saturday, August 8th, operating from 9 a.m. to 6 p.m. This is a free testing site. No appointment or doctor's order is needed. It is a drive-through testing site. In addition, our second Indiana State Department of Health testing site, which is currently located at Durkin Elementary School on 18th Street, is still in operation Monday through Friday from 8 a.m. to 8 p.m. It's also free with no appointment needed. This site will be moving on Monday, August 3rd, to the former Happy Hollow Elementary School, which is currently serving as the West Lafayette City Hall, located at 1200 North Salisbury Street in West Lafayette. Those are all the remarks that I had for this afternoon, so I'd like to open the floor to questions from the media and from our Facebook Live audience. Thank you.
Dr. Ramirez, I'm Jordan Smith with the Purdue Exponent student paper. I'm just hoping you can outline the process Purdue Athletics has been using to report athletes, coaches, staff to the health center and then the county and state health departments.
So the Protect Purdue Health Center does not manage the athletes. Dr. Day does. And so she is coordinating with our data team to be able to go ahead and report as a university. But I don't have the specifics of, that's kind of guided by a different set of rules. The NCAA has their own set of rules for that.
Follow-up to that, is there any chance that athletes who live out of state and are coming here could be registering incorrect addresses, as in their out-of-state addresses, and so cases could be misattributed?
I'm not aware. I'm not sure.
Question from Emily Seiberg from WBAA. The statewide mask mandate says health departments, quote, shall be responsible for enforcing compliance through education about the importance of wearing masks, face coverings, and dispelling myths and misconceptions about the use and or benefits of the requirement. How is this different from what health departments have already been doing?
That's an excellent question, and it really isn't different from what we were doing prior to the face covering mandate. We have, for several months now, been a source of education and trying to get the word out about the importance of face coverings, helping people with questions they have about face coverings, and that will, of course, continue. We have signage that businesses and other organizations can print out for free from our website that can be hung in the place of business or at their organization, reminding their customers and clients about the face covering mandate that our governor has issued as of last week. So we're continuing with all those educational processes and really trying to encourage and support everyone in order to meet this mandate from our governor.
Couple things, Dave Bankert with the Journal and Courier. Dr. Adler, we're at 1,000 today. How long do you think we'll hit another 1,000 going at the rate we're at, or is there a way to make that not happen? I mean, what's it going to take?
Yeah, I mean, I think you know the measures that we need to everyone partake in are what I mentioned. We need to be wearing our face coverings as directed by our governor. We need to avoid crowds. We need to maintain our social distance of 6 feet when we're in public settings. We need to wash our hands frequently. We need to disinfect our frequently touched surfaces. You know, if we're sick, we need to make sure we're staying home. If we've been directed to quarantine because we're a close contact of a confirmed case, we need to take that seriously and quarantine. All of these measures are the things that are going to help bend our curve in the right direction locally. To answer the first part of your question, it is very hard to predict if and when we would reach another 1,000 new cases. It's just very difficult to predict even what's going to happen within the next week. So I don't have a definite answer for that part, but those measures that I mentioned are what we all need to be doing to help keep things moving in the right direction for us locally.
And if I might add to that, having a local ordinance, and like we do in the city of West Lafayette, it actually allows for us to have some teeth. So we actually have our neighborhood resource team actively enforcing the law, whether it's something they see or they get a complaint on it. And as it stands right now, we have not issued any citations, just a lot of verbal warnings. And you would be amazed at how many people say, well, what if I don't? And it's always nice to be able to say, well, then you're going to get a ticket. And you know what that means. And they all understand that. It's sort of a soft hammer approach that allows for us to have a little bit more than the power of suggestion and the expectation that people will voluntarily comply. The other thing is that anymore. There's a lot of peer pressure going on. Early on in the COVID virus, you would go to a store and it would be maybe 30% of the folks that were wearing masks. You go into a store now, and I'm only speaking specific to West Lafayette, it is not everybody, but I would say a good 90+% are wearing masks. All the staff are, most of the people in the stores are. And they're very conscientious about not just wearing the mask, but also about social distancing. And as Dr. Adler alluded to, we aren't going to get over this by magic. It's going to take some discipline, and it's going to take people understanding the right things to do.
Thank you.
Meredith Heckler, it's WLFI. So I have a quick question for you. I'm sure, like many media outlets, we get suggestions or, I guess, tips every day that certain businesses have cases of COVID-19. When or why would you not notify the public of those specific businesses that have had them or have not had them? And is there any plan to create any kind of like a database to let people know, hey, this specific business or this area has had COVID-19 cases?
Yeah, that's an excellent question. We also hear about those tips, and the first thing we do as a health department is first we try to verify whether there truly is an outbreak or how many cases really are in a particular location. What we find in many situations is that the number of cases that you hear through the rumor mill is not accurate, and that there actually are fewer. But in situations where we do identify a cluster of cases, and in particular if it's a business where we feel like customers or other staff, employees at that business maybe have been or are in danger of contracting the virus, we always work with that business to inform other employees, and if necessary to inform customers who may have been at that business on a certain day at a certain time, to monitor for symptoms and so on and so forth.
Question from Facebook Live. Are we allowing houses of worship to operate with higher allowances for attendance?
The most recent capacity ruling from the governor's executive order does cap social gatherings at 250 people. There is a carve-out that allows for more than 250 people as long as an organization submits a plan to the local health department outlining the measures that are going to be taken to ensure social distancing and reduce transmission of COVID. So there is a way for organizations to, if they have appropriate plans, to hold events that involve more than 250 people.
Question for Dr. Ramirez. Will Purdue students be tested again several days after arriving on campus due to traveling?
No, there's no plan for that. Every student is asked to sign the Purdue Pledge, which includes exactly what Dr. Adler mentioned of 6 feet social distancing, wearing your mask, good hand hygiene. So when they arrive on campus with a negative test, from there on forward, they're monitoring their own symptoms and doing those other measures as well. Once everyone arrives, August 24th, from that point forward, we're doing symptomatic testing, and also those who have been around a high-risk contact. So if you ate lunch with somebody who was positive, that would be the time that we'll be doing those testing again. So there is no anticipated asymptomatic testing that's going to be done starting the fall, only symptomatic and high-risk contact.
Dr. Adler, are you comfortable with what you've received as Purdue has changed how it's done with testing and with just reopening? And what's your prediction for how those first weeks are going to go in terms of number of positives that come out or problems that arise with having 40,000 people arrive?
Mm-hmm. Yeah, I think the biggest area of concern, of course, is what happens off campus when you have 30 to 40,000 college-age students arriving. The Protect Purdue plan lays out some very good measures for activities on campus and measures that need to be taken to reduce the transmission of COVID-19. But outside of the campus, that's where the main concern lies. And certainly, there's always an increased risk of COVID-19 transmission with any large population, especially a population that lives and exists in close proximity to each other with frequent social events and other campus activities. So that's where the main concern lies, and it's going to take a lot of education and reinforcement of these measures that all of us, students and non-students alike, need to continue practicing so that we can really keep our COVID-19 situation under control here.
And if I might add to that, this isn't new anymore. I mean, people are acutely aware of how easily transmittable this is. The other understanding is that people are starting to take more and more responsibility for their own behavior because of how it impacts others. The Purdue Pledge, if you read it, is pretty comprehensive, and it doesn't just apply towards the geographic footprint of Purdue. It applies even beyond that. The other thing is that the students that live in our neighborhoods in West Lafayette are going to be held to the standards of those neighborhoods. And a lot of the folks have been doing everything by the book. And should a student or students move into an area and do not, they will report that, I'm sure, to the city, and then we'll go ahead and take the appropriate action. But as we go further down the road with COVID, and if we see how easily it can be contracted, we see the simple tasks that can be done to limit that, I think we're going to get much more voluntary compliance. And that's on two levels. First off, nobody wants to get sick, but I think when people understand that, nobody wants to get somebody else sick either.
Just to follow up on that a little bit, Mayor Hogsett in Indianapolis closed the bars. Is that something that has been considered in Tippecanoe County, especially as Purdue comes back? And is that something Purdue would favor to help its reopening plans and to try to curb potential super spreader kind of moments in a packed bar?
So currently, bar and restaurant capacity is limited by Governor Holcomb's executive order. And what we have been considering is extending those capacity limitations if and when the governor decides to lift those. That sort of capacity restriction, though, would necessarily need to apply to all restaurants and bars in the county, not just those in the campus area. So measures like that are being considered, and we may very well need to do something like that. But as it stands right now, those capacity restrictions are required across the state through the governor's executive order.
And again, I keep on pigging back on Dr. Adler. But there's a reality check here. And if the proprietors don't maintain a clean house, the eventuality is that they will be closed down. Because if this proliferates like it did early on in the COVID virus, we shut down the entire state. Nobody wants to go back to that. And that's one of the mantras I keep on telling everybody. You might not like me for what I've done, but you might hopefully appreciate the actions because it'll keep everybody back in business. It's just common sense. The students are going to have the same understanding. I don't know how they felt about not being on campus when it was closed, but I'm sure that they prefer to be back in school, at school. So, as I said earlier, this isn't new. This isn't fresh. We all understand what we need to do. Sure, there's always going to be folks that are rebellious, and that is the age where that's probably more commonplace in people that are my age. But there is a greater good here, and the hope would be that as adults, young adults or older, that they'll comply and understand.
Follow-up question from Emily Seiberg from WBAA. How will the health department dispel myths and misconceptions specifically regarding face coverings?
Well, I think it goes back to the education that I referred to earlier. Part of that education, of course, is making people aware that the mandate does exist and that we are all required to follow it here in the state of Indiana. And then also educating about the importance of face coverings to reduce the transmission of COVID-19. And then also education about the safety and really lack of danger to wearing face masks. That's one of the myths that exists currently, is that wearing a face covering is actually or can be hazardous to one's health, and there really isn't any evidence to support that at all. And so that's one of the myths that we would be working on dispelling through education.
If I may, I just wanted to answer Dave's question from Purdue standpoint. I think Purdue would be in favor of not only on-campus but also off-campus safe gathering. So as long as we're continuing to follow the guidelines that are set by our governor and our local mandates, we would support that.
A follow-up on this bar topic. Kentucky's governor just announced a 2-week closure to bars and a reduction in dining capacity to 25%. Is a policy like that something that could work for the first 2 weeks of classes, for example, when all those students come back?
That's a great question. I guess with a short-term measure like that, I would be concerned about what would happen after that 2 weeks is over. 2 weeks is a very short period of time, especially in a pandemic where things are changing very, very quickly. So I don't think that a short-term measure like that would necessarily be something that we would look at here in the community, unless there was something about our local data that would necessitate something like that.
Following up on the education and myths, if you've been on social media lately, you've probably seen a video circulating claiming that hydroxychloroquine is a cure for COVID-19. We have a doctor claiming that. So this is my question for the doctors in the group. What would you say to that? And a lot of people are questioning, what is working when you're treating COVID patients? What type of treatment do they have? And what have you guys seen success with so far?
So first, hydroxychloroquine is not an effective treatment for COVID-19. There's just no truth to that whatsoever. In addition, hydroxychloroquine does have some potentially serious adverse effects that can occur. And so there are numerous reasons why hydroxychloroquine should not be prescribed for COVID-19. In terms of other treatments that have been effective, there are really two that are still in their experimental phases, and Drs. Bean and Wicker can chime in on this also. They may be more aware of these things. One is an antiviral medicine called remdesivir, and then the other is convalescent plasma, using plasma from people who have recovered from COVID-19 and hoping that the antibodies that are present in that plasma will help to treat COVID-19.
Yeah, I completely agree with Dr. Adler. Really, the principal approach to treatment is standard, high-quality supportive care, and then for select patients, the two specific treatments that Dr. Adler referenced are being used. Completely agree with the absurdity of the assertions that have been coming out, and I think we've seen the appropriate backlash to that and removal of that information from many sites. There are many sound, legitimate resources that I would encourage people to look at, starting with the CDC, the World Health Organization, the American Academy of Pediatrics, the American Medical Association, et cetera, legitimate sites that will provide valid, evidence-based recommendations.
Agree with all that. And one of the other changes we've seen over the course of since March to today is the way we've changed in treatment for the use of ventilators for patients. And so early on in the course of treatment, particularly we saw that in New York City, pretty much there was a wide use of ventilators and therefore became a shortage. And so we're all concerned about that. But today the idea of how and who and when we ventilate patients and put them on a ventilator has changed significantly, so that our ventilator use for individuals with COVID positive, who are COVID positive, has decreased significantly. And I think today we don't have anyone who's COVID positive on a ventilator. So that's a significant change in a course of a couple of months of how we treat patients. Also, we used to have patients primarily lying on their back, and now we're proning them, so we're turning them front to back, and that's made a significant improvement in how we treat patients and how well they do and how they recover.
Thank you.
Question from YouTube. What is the average turnaround time for test results at our testing locations?
Another great question. And Drs. Bean and Wickert can certainly chime in on the hospital testing sites. In general, the hospital testing sites, the turnaround time has been between 24 and 48 hours. For the State Department of Health testing sites, it is also 24 to 48 hours. Some of the commercial labs and other laboratories that are testing for COVID, unfortunately, are having turnaround times of 6 to 10 days, which is quite a long time to wait for a test result and to know whether you have this and whether your close contacts need to quarantine. So if you have a choice in the matter, going to one of the hospital testing sites or one of the State Department of Health testing sites would be preferable because the turnaround time is shorter for the test results.
You've all seen the school district's plans at this point. Are you comfortable with those, number one? And number two, what advice would you give to parents who are deciding remote learning or in-classroom setting?
You know, I think that the mask mandate helps greatly with reducing the transmission of COVID in a school environment. So that is a step in the right direction. Certainly, the schools are working hard at rearranging their schools and their classrooms and everything else that they're doing to promote social distancing and have social distancing in place and hand washing, many of the measures that we talked about. And all those things are extremely important to reducing the transmission of this disease. There's always going to be a concern anytime you bring a group of people together, whether they're students or non-students, into a building for a prolonged period of time, day after day. And so those are things that are, of course, very concerning to everybody. I think, you know, from a parent standpoint, you know, it really is a personal and family decision. And I think one of the things to take into consideration is the health status of your children and the health status of the parents, and if there are grandparents living in the home or who are involved in caring for the children, you really need to take that into consideration too, and decide as a family what works best for your particular situation.
I'll just add, I completely agree with Dr. Adler said. I'd also say it is so important for kids to go to school. There are benefits beyond education that accrue to everyone, and some specific benefits that accrue to a subset that they otherwise wouldn't get were they not in school. To me, that is the message that reality, if we want that to work for our kids and for our families, as a community, we have to be all in on doing everything else we can to keep things under control. So going back to the basic public health measures that Dr. Adler references every single time we gather, the basic stuff we all have to be on board for, or the plans that Purdue is setting up, the plans that Tippecanoe County schools, Lafayette schools, West Lafayette schools are setting up are not going to be sustainable, because the disease burden will increase to the point that we're going to have to pull the plug on those kinds of gatherings. I think that would be a crime and a huge shame. We should be compromising other things in our community before we compromise our schools. So we need to go all in on these other restrictions if we want the schools to stay open.
Just a follow-up to that, I know that professors have raised this in surveys on campus, and other people are raising it with parents as well. At what point would you say it's time to go back to what we did in March and shut down and go to remote learning? Is there a marker among the things that you have on the board that would really tell us that we're close to that moment and having to pull the plug?
You know, the decision about whether to close schools down completely, like we did earlier this year, would really depend on whether we experience a significant surge in community transmission of COVID-19. I don't have a specific number I can put to that or percentage I can put to that because we monitor the trends in all these data points, and there are so many possible permutations of that data that would indicate that things are reaching a bad point or a crisis point. I think, though, that I would imagine that if our community experiences some sort of significant surge that would necessitate consideration of school closures, we would probably not be the only county in Indiana to be experiencing that. It probably would be something that would be happening in our surrounding counties, possibly even through our entire state. And so in those situations, some of those decisions, just like they did in March, would likely come from the state level. So it's not just what's happening in our community, but what's happening throughout the state of Indiana that would affect that sort of decision making.
Previously, it was reported that there were significant surges in cases in the Hispanic community here in the greater Tippecanoe County area. Is that still the case? And previously, it was said that there were going to be made more like resources available for them. Have those things happened? Have they been put into Spanish so that people know what they need to do? And then also, has there been any other clusters that have been identified?
So for the Hispanic population, we have translated our educational materials into Spanish and have made those available to our local Hispanic community. We've also reached out to area businesses and churches that serve large Hispanic populations. The percentage of our cases that cumulatively amongst Hispanics has remained about the same, 22%, but that's cumulative. So recently we have not seen any significant increase within the Hispanic community. So hopefully the message is getting to the right people in ways that they can understand in their language so that we can prevent a future increase.
Question from Facebook Live. If a business is observed as not following the mask mandate, what is customers' recourse to let someone know?
Well, you know, certainly one course of action would be to notify the health department. The governor's executive order does authorize the health department, local health department, and state health department to enforce the mask mandate Again, that enforcement's through education. So the health department can contact that business and work with them to improve compliance with the mask mandate.
Mayor Dennis,
Yes.
can you, a question about the mask mandate that you issued. Can you explain the rationale for the exemption that I believe exists for people in religious facilities or attending religious services?
A lot of that was just based upon some of the other guidance that we have out there. We realize that there are some gatherings that would be a greater challenge to control, at least from the outside in, and easier to control from the inside out. When we talk about religious gatherings and things like that, the general consensus is that you've got a relatively compliant population base, that should the leadership encourage wearing the mask and keeping the distancing, that would work. Because I know a lot of houses of worship have done everything they can to try and open back up, and that's the general mandate to those that choose to attend, distancing and masks. So we feel that that's kind of like self-policing. That event would be self-policed.
And then Dr. Adler, did churches have to file sort of like systems for reopening and ensuring that compliance existed? Because there are sometimes hundreds of people going to those services, it seems like.
So churches are addressed as part of the governor's executive orders, and they're expected to follow the measures that are required of them through those orders. There's not a requirement for churches per se to submit plans for COVID-19 to the health department. However, social gatherings of greater than 250 people do require a submission of a COVID-19 plan to the local health department for approval. So that could definitely impact some of our churches, larger churches, where they may have greater than 250 people at their services.
Question from Facebook Live. According to the local school's back-to-school plan, if a case or suspected case appears in a school, the administration will follow guidance from the health department. How quick will the health department offer guidance to the school, and are you hiring additional staff to manage the additional claims?
So basically, as soon as the health department is aware of a case, we start to work on that case, particularly if it involves a school situation. So I think that process would happen relatively quickly. We want to be able to respond to a case or cases within a school and put in place measures that will help protect other students and staff there. As far as hiring more staff goes, I would love to. That all depends on our budget and the funding that we are allowed through the county and through other grant sources.
Another question from Facebook Live. How close to arrival does a Purdue student have to prove their negative result?
We prefer within 2 weeks timeframe, but we also understand that with, as it was mentioned previously, as some of the labs are getting backed up to 10 to 14 days, it would be prudent for them to get it done within about a 3-week timeframe.
Okay, if there are no further questions, thank you all for attending, and we will see you next time. Thank you.
Will that be another 2 weeks?
Yes.
Good to see you.
Good to see you as well.